Hello, good afternoon, or good morning, or wherever all of us, in particular, are in on Earth, and a very warm welcome to the first webinar series for the Malé Declaration. Today, I'm very happy to see many of us here joining, in particular from many regions of the world. I'm Vanessa Surapipit. I'm the head of the Air Pollution Cluster for the Regional Resource Center for Asia and the Pacific based in AIT, Asian Institute of Technology in Thailand. So today I'm very, very happy to working together with the South Asian Cooperative Environment Program, or SASEP, that is the secretariat mainly driving at the moment, together with our technical support for the Malé Declaration. So I hope that you have heard something about the Malé Declaration along the history line, but since that it's has not been heard too much in the last few uh, decades. So I am very pleased that today, with the leadership of SACEP, we have started the webinar series today, and we will have more of the webinar to share more and more of what is happening to the transboundary air pollution in the region, because in this webinar, we will learn together about what the or both the scientists and the practitioner are joining hands in order to working, delivering messages to the policymakers so that we have a better air quality in South Asia. So the full name of Malé Declaration is Malé Declaration on Control and Prevention of Air Pollution and its Likely Transboundary Effects for South Asia. And it has been adopted since 1998. So this is a very long intergovernmental agreement that still exists in South Asia. And without wasting much time, I would like to ask everyone to welcome the welcome remarks from the director of RCAP at AIT is director. Our director is Dr. Gilberto Borongan. Actually, he has got another commitment running in parallel, so he sent his welcome remarks in his video. So please all welcome him and listen to his welcome. Thank you.
Thank you very much, Dr. Vanessa. Mr. Norvo Wangchuk, Director General of South Asia Cooperative Environment Program or SASEP. Sawadee krap, good day, good afternoon, distinguished guests, colleagues, partners, and participants. On behalf of the Regional Resource Center for Asia and the Pacific at the Asian Institute of Technology, EIT, based in Thailand, I am pleased to welcome you all to this webinar on women driving changes in air quality management for better air quality in the Malé Declaration. Today's session is both timely and meaningful as we continue to address the growing challenges of air pollution across South Asia. It is important that we recognize and strengthen inclusive leadership in this space. And this webinar not only contributes to the broader goals of the Malé Declaration, but also highlights the important role of women who are shaping policies, advancing research, and leading practical solutions on the ground. The Malé Declaration has long provided a valuable platform for regional cooperation and knowledge exchange. Through this webinar series, we aim to further strengthen capacities, encourage peer learning, and connect experts with practitioners and young professionals who are eager to contribute to cleaner air in their communities, cities, and countries. Today, we are honored to hear from distinguished speakers representing government, research institutions, and regional organizations. Their experiences will provide us with insights in both the progress made and the challenges that remain in air quality management across the region. I encourage all participants to actively engage, reflect on the discussion, and consider how these insights can be translated into practical actions in your respective contexts. With that, I wish you all a productive and inspiring session through this webinar. Thank you very much.
Okay, thank you very much, Dr. Gilberto Morongan, who has already welcomed all of us to this particularly important first time of the webinar for the Malé Declaration. The most important person today that I'm actually, he initiate this program is the Director General of SACEP, and I would like to take this opportunity to welcome for everyone, on behalf of everyone, to welcome Mr. Norbu Wangchuk, the Director General of SACEPS. Please, everyone, please join me to welcome him.
Thank you. Thank you, Dr. Gilberto, and thank you, Vanessa, for organizing this very important conversation. By the way, am I audible, Vanessa?
Yes, you're very good. Yeah.
And a very warm greetings to all, not just South Asian family fraternity here, but I can see a lot of members from beyond South Asia. A very, very warm greetings from Colombo here. Let me begin by maybe by way of introduction, say a few sentences of about South Asia Cooperative Environment Program, SASEP, an organization where I serve currently, especially for those of the participants who may not be familiar with SASEP. This is an intergovernmental organization established by 8 South Asian, traditional South Asian countries way back in 1982, with a convening mandate to oversee regional climate change and environmental challenges. SASEP is also a secretariat to Regional Seas Program, registered under the UN framework, taking care of the marine pollution in South Asian region, where again 5 coastal countries of South Asia are the members. And what is very pertinent to this conversation is that we are now the secretariat of the Malé Declaration, and AIT RRCP had been our technical partner for a very long time. In fact, ever since Malé Declaration was instituted. Malé Declaration, in many ways, is a pioneer and visionary regional platform that is mandated to oversee air quality in South Asian region. And it was instituted at a time where air quality was not in the priority area of many organizations and in the people's mind. And in fact, Malé Declaration, as way back as 1998, recognized that air pollution is transboundary in nature, and so therefore the more meaningful and systematic solution would be through regional approach. So over the years, ever since it was established 1998, uh, now today science has become stronger and a little more precise on air quality. Our collective knowledge on air quality in the region has expanded globally as well. And many actors and stakeholders are coming in collectively to address this big crisis that we are facing, poor air quality. So now we have established several things. The first thing that we have established is that South Asia is amongst the most polluted region in the world. I mean, we don't need World Bank or the ADB or the UN IPCC report to tell us that. Our residents, our people who are living in Delhi, cities like Delhi, Dhaka, Karachi, or even Kathmandu, experience poor air quality most times of the year. And in fact, breathing in, according to WHO, hazardous level of pollution. What we have also established is that 2 million people in South Asia die annually prematurely because of poor air quality. And this comes from uh, the estimates from World Bank and the WHO. The third thing that we have established is that that airshed region, the Indo-Gangetic and Himalayan foothill regions along the Himalayan range, is perhaps one of the most toxic airshed we have there. And within that, people living within that airshed are 1 million people die prematurely every year. What we have finally established is that in terms of the economic loss due to poor air quality, the estimates are that 10% of the collective GDP of South Asia is lost annually due to poor air quality. Loss in terms of productivity and loss in terms of adverse health impact. But this doesn't have to be the situation. We don't have to be the most polluted region in the world. We don't have to lose 2 million lives prematurely to air quality. And we don't have to lose 10% of our GDP annually to poor air quality. We can change this situation. And I say this because we know the solutions to it, whether it is in the energy sector, whether it is in the transport sector, industrial sector, agriculture sector, or household energy. We have the technology, we have the know-how, and we have the solutions, the modeled solutions available to us now. And we also know that to address this solution, it would take 0.1% of our GDP only to revert this situation. And in fact, indeed, each of the member countries, whether it is in Pakistan, India, Bhutan, Nepal, Sri Lanka, Maldives, or Bangladesh, every member of the country are in fact have initiated a lot of actions and projects and programs to address these air quality challenges that we are facing. But how much soever we would do at the national level, because the air quality is transboundary and regional and uh, shared ecosystem, it would take regional approach. It would take the countries coming together for a collective action. So that jump needs to be made now. The region coming together in collective action unlocks a lot of potential and shows up a lot of opportunity. And now we have come to a phase where we transcend from the blame game to the collective action phase. So within this context, I would welcome uh, discussions and conversations such as the one that we would be having today. Because only through conversations like this, only through coming together, we would have actions at a scale, at a sustainability, and at big significance. The theme today is women driving change in air quality. We are not having enough of a conversation where women and air quality. A lot of conferences, a lot of conversations are taking place, but women are not included. Women's interests, women's vulnerability are not included in these conversations. So we need to have many more of these conversations. Extremely important because our women are more vulnerable than anybody else, especially because women still large number of women are homemakers and the first caregivers. And this double burden or triple burden that the women shoulder puts women in a very vulnerable situation and become the first victim of air pollution. And so these conversations, in my mind, are targeted to bring in bring in the woman's situation, woman's perspective, woman's interest, and to see how we can then therefore bring up the woman from a position of vulnerability to a position of agency as change makers, as this very theme is suggesting. So I'm very happy and delighted that I'm part of this conversation and look forward to a very productive conversation. There are wonderful panelists lined up and a lot of interested participants to these discussions. So thank you once again for your attention and thank you for this opportunity. Thank you.
Okay, thank you very much, Mr. Norbu Wangchuk, who has already encouraged all of us for the discussion, and he is the one who inspired us, at least, as the women. I'm very, have very fortunate to have been a part of this change that we need in order to really drive up the better air quality. Before we started, actually, I can just mention that we welcome all the question that you have. So please feel free to post any question in the Q&A box on this webinar so that we know what you think and we know also your comments you are welcome to do, and if possible, time allowed, we can answer all the questions. Otherwise, we will answer that at the next time, because this series will continue at least for this year until August. Anyways, before we start, let me ask all the speakers if they can turn on your camera, and we have a chance to take a group photo firstly for all the speakers, please. And I will gradually introduce each of us to the audience here. I think, yes, today live with us, only, yes. Okay, because unfortunately, Miss Vidya Banmali cannot join live because she has an urgent meeting right in Kathmandu. So, but please signal for the picture at the moment, please. Mianchu? Is it done? Okay. Okay, I think that's it. Okay, thank you very much. And I will gradually introduce each of us. As I just mentioned, we have the chance to actually joining with a number of distinguished speakers that normally they don't have much chance to speak, I must say. And today, just unfortunately, that Ms. Vidya Pradhan cannot join from Nepal. Actually, as you must have seen in the flyer, it's the her that working in ISIMOT, which is a integrated center for mountain development that take care of actually 8 uh, member countries in the Himalayan region, and 5 of the ISIMOT member country are a part of Malay Declaration region, which cover the whole South Asia. So today I will just need to just briefly mention about the activities. We have had just the latest discussion at the better quality in took place in Bangkok earlier this month, and we so I will take the opportunity to review people about what is happening in the IGP HF region, which is the Indo-Gangetic Plain and Himalayan foothills, which otherwise Vidya should have mentioned about that. But this is just a part of my presentation that has been shared with ISIMOT and other, and in particular with the host of that event, not only Clean Asia, which we have Ms. Glinda Batan, the executive director, joining today, also with the Asian Development Bank and the World Bank and Climate and Clean Air Coalition, UNESCAP and UNEP. So let me just briefly mention about this to take up the part that Vidya should have talked about, although she said to me that she will actually join us in the near future time. Okay, so we already talked about the background of the Malay Declaration, which is started in from the discussion round table policy dialogue in 1998 at AIT in Bangkok. And afterwards, they have the Ministry of Environment from all the South Asian country met in Malé, Maldives. And today we are so lucky to have a representative from Malé again also to join the webinar to share what they're doing out there in Maldives. And the member countries has, as you see on the screen, Bangladesh, Bhutan, India, Iran. Iran also has, insisted that they like to join as a part of this transboundary air pollution to tackle that. And Maldives, Nepal, Pakistan, and Sri Lanka. So all the Ministry of Environment and related agencies were like driving upon that. We have had a meeting last year in June to a sort of revitalization because many of the Malay Declaration activities were not that active during the COVID in the year 2020 and afterwards, because also with the funding support that still under discussion. But still, we have a very good turn up of other member countries, including supporting donors in the past. South Stockholm Environment Institute that has still a number of driving force and from Mr. Johan and also Mr. The regional facilitator, Mr. Kamyotra, formerly CPCP from New Delhi, and all the other donors there, including in UNEP, Ms. Nation Sharing. That meeting enabling what we call scoping study. So as you can see, this is the picture I took from Suryampu in Nepal. That is, you have no visibility of the Himalayan mountain range, which is a pity. So we travel across to many countries, at least 5 countries at that time, in South Asia, talking and asking and interviewing the officials and also stakeholders in South Asian region, that is in Bangladesh, in Bhutan. In Bhutan, they have a few stations up with the support of ISIMOD. And so Mr. Kamjotra and Dr. Gilberto has been there together with me to see the stations. And we have had the workshops among the practitioners. Mostly they are very young and are very attentive, in order to work it out with the equality management. And also in Maldives, we have met with the permanent secretary and the related, and also in Nepal, met with Mr. Ashish Tiwari, the lead air lead in the program of ISIMOD, which driving much of the IGPHF region, and in Sri Lanka also with the permanent secretary, additional secretary, and also with the university that we have met in Bangladesh. As you can see that this is just a part of the findings that we are going to publish very, very soon, the scoping study report. This is a quality monitoring stations across the Malé Declaration member countries. So what's important, you can see here, is that in India, you can see that there are just thousands of the continuous ambient air quality monitoring stations, as big as the country is. Still, that's we can hear afterwards from Dr. Abhinaya Sekar from Health Effects Institute if this monitoring is sufficient or not. Otherwise, you can see that there are less of that continuous ambient air quality monitoring station, but only the low-cost sensors, mostly in the south. Like in Maldives and Sri Lanka, doesn't seem to have the operating continuous ambient air quality monitoring station. But how they are dealing with this, so we will hear soon from the speaker, Ms. Aminat Maiha Hamid from Maldives today, and also with from Sri Lanka, Ms. Vernika from the Central Environment Agency. Anyways, we know that in India, not only have a lot of monitoring station, but also have the capability to do equity management up to the level of forecasting. This is a real-time operating equity forecast from India website. You can enter with this was established with IITM in Pune. However, at they have already supported a number of our IGPHF country, including Nepal here, as you can see from the official website of Department of Environment in Nepal, that they are conducting a quality watch. So it's possible to check up about the status of the latest quality, including very soon capability to do forecast. But of course, there are a lot of technical limitation, including in particular the emission inventory. So that will be one of the topics that we will cover during the webinar series. And so we will encourage the exchange of knowledge that will support the policymakers, as you can see in this web in there. So just that I want to tell how we have been concluded with the scoping study that I have mentioned about, that in Malé Declaration country, very fortunately, 5 member countries has been at the moment being tackled by ISIMOD, and the World Bank has developed a regional emission inventory, not regional, but for each country. Only 5 member countries at the moment, including from Bangladesh, Bhutan, Nepal, Pakistan, India, but not Maldives and Sri Lanka. So one of the questions that we have got at the moment is that how to combine, the regional emission inventory, like so that we can do the pollution impact assessment and potentially forecasting that cover all of the population in South Asia. So one of the recommendation is that we should have the data sharing platform that similar to maybe in Southeast Asia have got, but still also not that complete, but at least possible to do forecast early warning for this haze situation, for example. Anyways, the second recommendations that we have got from the scoping study that has been conducted last year is that we should strengthen we should strengthen the technical and institutional capacity for modeling and long-term monitoring. This is important because if actually, I'm someone from East Asia, so I have the chance to join in the activity that is supported, has been supported by the regional network of ASEAN country. And in collaboration with the Japanese experts, and we have like Japanese and also the Chinese expert, and including Korean experts from the East Asia. So like we have had a model intercomparison study in Asia, which is called the Mixed Asia, that is existing in the East and Southeast Asia only. So it has not covered South Asia or has not included. There is also EANET, the East Asian Network for the Acid Deposition, which has a very good long-term monitoring. So, but in South Asia, we will hear in a few more minutes after about what is going on. But as much as we learn that it's not as much and it's not up to the level that we can monitoring the change in a long term as it happening in East and Southeast Asia. Okay, and the third point that we have got learning from scoping study is that we should integrate the air quality goals with the climate and health policies. So in this webinar today, we just start to talk about this, but we will talk more and more about this, and you will hear more and more about this. I believe that the co-benefits that, for example, nowadays it has been identified as super pollutants, or formerly called the short-lived climate pollutants, as the CCAC, the Climate and Clean Air Coalitions, have mentioned for many, has addressed that issue for many years, that PM 2.5 or ozone, these pollutants should be regarded as a short-lived climate pollutants because it's a potential effect to the warming. And if we can reduce that, it's like a super pollutants. Okay, so that's one of the key things that should be addressed further on. And the next one in the findings that we have got from the scoping study is that we should establish the financing mechanisms for the clean technology adoption. So this has been addressed in the ITPHF project supported at the moment by the World Bank and ADB as well in the 5 countries, as I mentioned, Bangladesh, India, Nepal, and Pakistan, and probably Bhutan has got that clean technology as well also, that is still combining together with the new development that they are going to have now in the southern part. The question is, can Malé Declaration gain support also from the huge project? This is something that we are still working out, or how can we support the activities and strengthening the investment that will make the change in South Asian whole South Asian countries. So the possibility to approach also the philanthropy like the Clean Air Fund, or on the what I mentioned, the black carbon part of the PM2.5 and ozone. Okay, so because I just talk on behalf of the part that Vidya should have mentioned, or this is just what I would like to share today. The last point that I can mention is that we hope to for the Malé Declaration to be promoted up to the point of having a joint action plan for the South Asian countries at the intergovernmental meeting soon. So with the Malé Declaration framework will be like a sustainable regional cooperation, and we can work it out towards the net zero that many countries have made the commitment. So I believe that through the coordinated commitment, South Asia can achieve the measurable improvements in the air quality and public health and environmental sustainability. So actually the key findings that we have found is actually um, a work jointly among the core team member, including ACI and also Mr. Kamyotra and other members of the core team, in particular Vidya herself. Okay, maybe some of you already know that we may have some activity, or if you have not known about that, actually in South Asia, there is the what we call the Maldives Climate Observatory at Hanimadu, the MCOH. This is one of the activity that we have had a chance to AIT has a chance to work with Stockholm University to support the ongoing activities to observe black carbon. So this is just that preliminary results. And also there are quite a large number of activity that we can do. Also this webinar is one thing. And also we already published the fact sheets of the Malé Declaration member countries. You can scan in this QR code in order to obtain some of the air pollution fact sheets we have published. And it's still not that reviewed as much, but we hope to receive the comments also if you are from the South Asian country, and if any improvement that we should do and cite in the fact sheets, please do not hesitate to let us know as well. So we're trying to working together, and at the moment, as the DG of SACEP has already mentioned, we're trying hard to bringing in all stakeholders in order to have a better equality. Okay, thank you very much, ขอบคุณค่ะ and I think I stop now this sharing. Which is like an introduction part from my side on behalf of Vidya. If you have any question, or if not yet, it's all okay. We continue to the next speaker. I read it the moment Dr. Bharati Paul said the Himalayan airshade is among the most polluted in Asia. Yet emissions from forest fires, major source of greenhouse gas and particulates, remain unmeasured across the different fire stage. Yes, this is the big issue. So the question is about what initiative is your organization undertaking in the Eastern Himalayas, including Northeast India, Bhutan, and Southeast Asia, to address this gap? As an early career atmospheric scientist from this region, how might I contribute? Okay, that sounds great. We will, certainly communicate further. There has been a number of projects, which unfortunately today I cannot speak much yet. The IGPHF project is being undertaken, leading by ICIMOD. So that cover already Northeast India, Bhutan, but not Southeast Asia, fortunately. And I think in Southeast Asia, we have ASEAN HAZE agreement framework, and each country is working on that. So certainly we need to welcome early career scientists to help out and find the solutions. Okay, I will not waste more time, and we come back to the Q&A again. I want to, at the moment, introduce the next speaker, which actually coming from the southernmost of uh, our Malé Declaration or the South Asian region. She is already with us for quite a while, and Miss Maiha Hamid is actually the air quality analyst at the Ministry of Tourism and Environment in the
Hello? Hello,
Miss
I
Hamid, yes, Miss
yes,
Hamid, you
yes.
go ahead. We just temporarily lost
Okay,
connection
okay,
with
all
you.
right,
Yes,
all right. I'll
go
go
ahead.
ahead. Okay, thank you. Okay, I thought I was stuck. Thank you. All right. Thank you, Dr. Manisa, for the introduction. Thank you, DG of SACEP. Thank you, Director of AIT RR CCAP, for the opportunity. And yes, welcome to my presentation. Today I will be speaking about air quality monitoring in the Maldives and how regional cooperation, especially through the Malé Declaration, has supported our progress so far. So air pollution is actually um, is often not the first environmental issue people associate with the Maldives. It's usually our ocean environment or our vulnerability to climate change. But air quality is increasingly becoming an important topic for us, particularly as our cities grow and as we better understand the regional movement of pollution across borders. So, in this presentation, I will briefly explain what air quality looks like in the Maldives today and how we are currently monitoring the challenges we face and how regional cooperation is helping strengthen our capacities. When we talk about air quality in the Maldives, the overall picture is generally positive. For much of the year, especially during the southwest monsoon season, from April to October, air quality remains relatively good. Our geographic isolation and small land area help limit many of the pollution sources that affect larger continental states. In fact, according to the 2025 IQ Air Global Air Quality Report, the Maldives continues to rank among countries with comparatively cleaner air in most months of the year. However, this does not mean that air pollution is absent. Data collected in the Greater Malé region, in the capital area, over 2024 shows that air quality is typically its worst between November and March, when we experience regional haze transport and lower atmospheric dispersion. During this period, we observe more polluted days on average. Another important point is that air pollution is often underestimated in small island states because the national picture appears clean. Localized pollution problems may receive less attention, but in dense urban areas like Malé City, we do see clear pollution hotspots. And these matter because it affects public health, visibility, daily comfort, and environmental quality. If we look at the sources of air pollution in the Maldives, transport is one of the most visible contributors, especially in Malé. Street level sensor data shows that daytime pollution levels are noticeably higher than late night levels, which reflects the influence of traffic and other human activity. And this pattern is typical of urban environments. Malé has one of the highest population densities, and a large number of motorcycles and vehicles operate within a very small area. This concentration increases localized emissions from transport. In addition to traffic, other important sources include diesel based electricity generation, waste burning, and a lot of construction activities. At the same time, it is also important to recognize that not all pollution measured in the Maldives originates locally. A previous study estimated that about 30% of PM 2.5 in Malé comes from local sources, while around 70% comes from distant regional sources. This long range transport becomes especially noticeable during the transboundary haze period when pollution from South Asia and surrounding regions affect visibility, air quality, transport conditions, and potentially tourism as well. So, our understanding of air quality in the Maldives requires both a local and regional perspective. Monitoring air quality is the first step towards understanding and managing pollution for us. At present, we have 6 operational low-cost IQ air sensors distributed and distributed across the country from the north to south. The data from these sensors is publicly available through the Air Visual application, which allows both the public and health authorities to follow air quality conditions in real time. This information is especially useful during haze periods when advisories such as wearing masks, limiting outdoor exposure, or using air purifiers may be recommended. In addition to these sensors, the Ministry has nearly completed installation of a new reference grade AQMS in central Malé, which will soon become operational. Another larger monitoring station is also planned for installation later this year. These stations will provide more accurate and continuous measurements of key pollutants, helping us better understand urban pollution patterns and support evidence-based policy making in the future. In addition to urban monitoring, Maldives also plays an important role in observing regional atmospheric pollution transport. In the northern part of the country, we host the Maldives Climate Observatory in Hanimadu. It was established through a collaboration between the government, UNEP, and an international team of scientists. The observatory measures atmospheric composition over the Indian Ocean and serves as a receptor site for long-range transported pollutants, including what is sometimes known as atmospheric brown cloud. This means that the Maldives is not only affected by regional pollution, but also contributes valuable data that helps the global scientific community understand how pollution travels across continents and oceans. Despite these efforts, there are still several challenges in monitoring air quality across the Maldives. One of the main challenges is limiting monitoring coverage. Limited monitoring coverage because the country is geographically dispersed across many islands. It is difficult to maintain a dense monitoring network. There are also technical capacity constraints since operating and maintaining reference grade monitoring equipment requires specialized expertise. Financial resources are another important factor. Monitoring equipment, calibration, maintenance visits, and data platforms, they all require sustained funding. Rapid urbanization in Malé adds another layer of complexity. We see Malé on the map here on the screen. Localized pollution varies significantly within short distances, which means city level monitoring needs to be expanded in order to properly understand traffic and human activity influences. Another recent setback occurred in December 2024 when a fire at the ministry building damaged one of the monitoring sensors in Malé. It happened in December and we can see it at the bottom. Since then, that data stream has not yet been restored. So while monitoring is improving, there are still important gaps that need to be addressed. And this is where regional cooperation becomes especially important for us. From a national perspective, the Malé Declaration has played a meaningful role in strengthening our capacity for air pollution. Much of this support has focused on training, technical guidance, and knowledge exchange. For example, government officials and technical staff from the Maldives have participated in regional workshops, refresher courses on air pollution, monitoring, and management. Passive sampling equipment has been installed at the Met Office in Hanimadu, helping strengthen early monitoring efforts. Participation in regional stakeholder meetings have also allowed the Maldives to learn more from advanced monitoring systems across South Asia and adopt relevant approaches to our own context. The declaration has also supported policy thinking by encouraging integration of air quality considerations into our environmental planning and national development discussions. Moreover, air quality is now more frequently discussed across agencies working in health protection, environmental regulation, waste management, and energy planning. As you can also see from the workshop image above shown here, many of the participants involved in these activities are women working across government, universities, and technical institutions. Women are increasingly contributing as researchers, analysts, and policymakers, and technical specialists in environmental monitoring and climate related work in the Maldives. Gaps. Although progress has been made, several important gaps remain. First, there is still a need for continuous nationwide monitoring system. At the moment, monitoring coverage is limited and not always permanent. Second, data-driven policy making depends on long-term data sets. Without continuous measurements, it is difficult to design targeted interventions. Third, enforcement capacity needs strengthening, especially for emissions from transport, construction, and small-scale pollution sources. And finally, public awareness is still developing. Looking ahead, the Malé Declaration can continue supporting Maldives through technical assistance, training opportunities for young professionals, improved regional data sharing, and approaches tailored specifically for small island developing states. Because our environmental conditions are different from larger countries, our monitoring strategies must also be adapted to our context. So, regional cooperation will remain essential as we move forward. To conclude, I would like to leave with 4 key messages: that air quality is becoming an emerging environmental priority for the Maldives. Regional cooperation is essential because air pollution does not respect national boundaries. Third, capacity building remains critical as monitoring systems continue developing in our country. And finally, that women are playing an important and growing role in environmental monitoring and decision making in this sector. Thank you very much for your attention.
Okay, thank you very much, Maiha, or Miss Aminat Maiha. That this is very interesting, at least to me, how you're trying to do the equality management in Maldives, despite not many resources out there. And I wonder if anyone have. I don't see any particular Q&A at the moment for Maldives. But anyways, we will come back to asking you any particular questions because as we know that, I mean, there are issues, I think, linking between for example, this PM 2.5 that every country monitor and the black carbon. And I believe that in Maldives, you don't yet have black carbon measurement apart from in Hanimadu.
No, yes, you're correct. Yeah, we don't.
Yeah. So I think, but the information that we have from Hanimadu, we also need to feeding into support the government of Maldives and the related any other governments in the region. Okay. Okay, thank you very much. Then, Maiha, and I will move on to the next speaker today. That we have the speaker from Sri Lanka. Actually, today only the speaker from the southernmost. I'm very happy that they can speak up because today, Sri Lanka and Maldives are very close to each other, and certainly that they have also facing a number of environmental problems relating to the equality. So they are here. We have Miss Vernica Ranawaka Arakshi, who is the director. If I can spell your name correctly, I apologize if it's incorrect. She is the director of the Air Quality, Noise and Vibration, the monitoring unit in the Central Environmental Authority. Ms. Vernica have had a long experience in this field, in particular that she has obtained her degree from University of Peradeniya and the master in Open University of Sri Lanka in collaboration with Osaka University in Japan. So she has a lot of things to tell us. So without wasting much time, let me on behalf of everyone to introduce and welcome Ms. Vernica. Please, I turn on the microphone to you. Can you turn on your microphone, please?
Ayubowan Vanisha, thank you.
Ayubowan.
May I audible, Vanisha?
Yes, I can hear you well.
Thank you
Yes.
very much. Thank you very much for your introductions. And I would like to thank the given opportunity to participate here for you and organizing committee, DG Sakip and DG AAT. Today, I'm going to focus your attentions on the equity management in Sri Lanka and expectation from the regional cooperation like Malé declarations. Actually, during my presentation, I hope to brief introduction regarding my institute, Central Environmental Authority, regulations imposed for the air quality management, ambient air quality monitoring, National Air Quality Network, Contingency Response Action Plan, Indoor Air Quality Improvement Initiatives, project activities and research, capacity building, and expectation from Malé Declaration. The Central Environmental Authority of actually CEA is the main regulatory institute responsible for protecting and managing the environment in our country, including air quality management, and is empowered by the National Environment Act. Under the Part 4B of the National Environment Act, the Central Environmental Authority has strong powers to regulate air pollution, ensuring clean air by monitoring, controlling and enforcing environmental standards. Accordingly, the National Environmental Ambient Air Quality Regulation was imposed in 2008, introducing permissible limits for the 6 criteria air pollutants, such as particulate matter, PM10, PM2.5, nitrogen dioxide, sulfur dioxide, ozone, ground level ozone, and carbon monoxide. In order to maintain, actually adhering the WHO guideline tier 2, in order to maintain the better air quality in the country, considering the main local air pollution sources, that is vehicle emission, it contributes in urban cities as percentage 55 to 60 percentage, industries and power plants and domestic sources. 3 regulations were executed under the National Environmental Act. The National Environmental Station Resource Emission Control Regulations is imposed in 2019 to regulate and manage the industrial air emissions. These regulations provide instrumental-based standard for high air polluting industries like thermal power plant, boilers, incinerators, cement kilns. Further, it provides standards for pollutant-based standards, pollutant-based cases, and fugitive emission control standards. Station resource emission controls regulation is implemented and enforced by our organizations, the Central Environment Authority, through the Environmental Protection License Procedure. Accordingly, we regulate and manage air pollution from approximately 1,000 industries out of the 20,000 prescribed industries located island-wide. Furthermore, project proponents are guided to manage potential air pollution from high-polluting large industries and project activities during the environmental impact assessment process. In addition, guidance is provided to industrialists when issuing environmental recommendations for the siting of new industries. In addition, CA involved compliance monitoring activities by doing measurements, total suspended particulate matter, PM10, non-methane volatile organic compounds, and asbestos 5. The National Environmental Standards for Vehicle Emissions, Fuel Quality and Vehicle Importation are imposed to manage air pollution from the transport sector. These regulations have been amended 5 times and periodically updated. The latest revision is compatible with Euro 4 standards. The framework consists of 3 components: vehicle exhaust emission standard, fuel standard, and vehicle exhaust emission standard for vehicle importation. Expecting the effective implementation of vehicle exhaust emission standard, responsibilities shared with the Motor Traffic Department, Department of Import and Export Control, and Ceylon Petroleum Corporation. Further, a comprehensive mechanism was established to implement these regulations. Accordingly, vehicle emission testing centers were established through public-private partnership. Vehicle Emission Testing Trust Fund was also created to support air quality management in the country. However, the fund has recently been absorbed into the Treasury. Though some areas for improvement, this mechanism and the regulations have made a significant contribution to reducing vehicle emission, while the fund has provided continuous financial support for air quality monitoring throughout the last 2 decades. The National Environmental Prohibition of Refuse and Other Combustible Material, including plastic regulation, was introduced in 2017 to prevent the open burning of solid waste and to control dioxin furan. This regulation is implemented with the support of the Sri Lanka Police. However, its implementation has been challenging due to the lack of comprehensive waste management system covering the entire country. As the regulator, our organization conduct ambient air quality monitoring. Further, we follow strategies, National Environmental Action Plan imposed by the Ministry of Environment and strategies introduced through 10 scopes. As the regulator, the Central Environmental Authority conduct ambient air quality monitoring using 2 automated monitoring stations provided through the Vehicle Emission Testing Trust Fund. These stations are strategically located in the main cities of Colombo and Kandy. The monitoring network has been further expanded with the deployment of 12 low-cost sensor-based units donated by UNDP. and the additional monitoring stations provided by the government of France extending island-wide coverage. National Air Quality Index, aligned with the international approaches, was established by the Central Environmental Authority in collaboration with relevant stakeholder agencies. This initiative was undertaken to ensure effective communication of air quality information from a public health perspective, while addressing public concerns regarding mismatches in data designations. Previously, the use of various international AQI systems, including the more stringent US Air Quality Index, had led to confusion and debate among the public. The AQL-SL was developed to harmonize reporting with Sri Lanka's national ambient air quality regulations, providing a consistent evidence-based framework that reflects both global best practices and local air quality standards. CA developed a software platform to integrate the ambient air quality monitoring equipment and establish national air quality network. Initially, this network integrated monitoring devices managed by CA, as I mentioned earlier, and the monitoring equipment deployed by the National Building Research Organization. In celebration of Blue Sky Day last year 2025, the Central Environmental Authority launched a national air quality monitoring network providing real-time air quality data to the public, empowering citizens with knowledge and information. According to the monitoring data, particulate matter has been identified as the dominant air pollutant in Sri Lanka as well as in many countries worldwide. When analyzing the monitoring data gathered through the network last year, shows a clear and consistent pattern across all monitoring sites. Especially for particulate matter, the data reveal similar fluctuations and trends regardless of locations. Over the past few years, higher level of particulate pollution have been observed from October to March. This same pattern was evident against last year and beginning of this year, confirming strong seasonal influences. Backward trajectory analysis clearly illustrates the transport pathway and directions of air pollutant reach in Sri Lanka. This analysis revealed that with the influence of the northeast monsoons, pollutants are transported over long distance into the country from other regions. This indicates that transboundary pollutant plays a major role, significantly contribute to local air quality deteriorations, accounting for more than 70% of the particulate pollution levels during peak period. This transboundary pollutant phenomena is a significant challenge for regulators, since a large portion of the pollution originated outside national boundaries and is beyond direct domestic control. In order to protect citizens' health by reducing exposure during high air pollution events, including transboundary phenomena, the Contingency Response Action Plan for Air Quality Management in Sri Lanka was developed by our organizations in collaboration with key stakeholders. This plan provides a structured evidence-based framework for responding to episodes of severe air pollution and safeguarding public health. The primary purpose of the CRAP is to ensure timely and coordinated response action whenever air quality deteriorates beyond acceptable levels. It is designed to support national preparedness, minimize public exposure, and mitigate both environmental and health impacts during pollution episodes by controlling local sources of air pollution. CREP is operationalized to define procedure involving multiple stakeholders, including government agencies, local authorities, and technical units responsible for air quality monitoring and disaster response. The plan controls real-time monitoring data and Sri Lankan Air Quality Index to detect and track pollution escalations. The main framework of the plan includes 6 key steps: monitoring and forecasting, decision-making, communication, implementation, evaluation, termination, and revisions. Air quality episodes were categorized into 3 stages: alert, warning, and emergency. The plan outlines specific actions. However, major operational gap is the lack of robust forecasting facility. It limits the ability to anticipate severe pollution events in advance. This reduces the lead time for early interventions and public advisories. Therefore, strengthen forecasting and predictive capacity as part of the CRAP framework is crucial. The Ministry of Environment Sri Lanka has taken an important step by introducing indoor air quality guidelines to manage and monitor indoor air pollution. However, there are still significant gaps. One major issue is the lack of sufficient research-based evidence to fully understand indoor air pollution levels across the country. In addition, public awareness of the health impacts remains low, particularly among rural and low-income communities. In Sri Lanka, many households still rely on solid fuels such as firewood for cooking, which is a major source of indoor air pollution. In fact, indoor air pollution can sometimes be even worse than outdoor air due to poor ventilation and pollution accumulation. Considering this aspect, CA conduct awareness program island-wide, focusing to aware school children, teachers, government officials, and general public. During last 2 years, we conducted 30 awareness programs island-wide. Moving forward, it is essential to strengthen research, improve awareness, and implement practical solutions such as cleaner cooking methods and better ventilations to protect public health. Expertise and training are crucial for effective air quality management. Prior to 2015, Sri Lanka had valuable opportunities to participate in capacity building programs through JICA and COICA and Malé project. However, in recent years, there has been a lack of comprehensive technical training. Many of the previously trained officials have retired and new staff have not had similar opportunities. This had created significant gap in expertise within the field. To address these issues to some extent, Central Environmental Authority has organized a 2-day training program with the support of both internal and external experts. Additionally, another training program was conducted with the support of Associate Professor Sarwat Tripon, Dean of Faculty of Public Health, Mahidol University, Thailand. Actually, international cooperation project that CE contributed, I will explain later regarding the Bali Declaration interventions. Our country contributed the project implemented as three-party agreement with Ministry of Environment, France Development Agency, and that technical expert in 2023 to 25. Objective is to reinforce the capacity of the Sri Lankan authorities regarding air quality monitoring and to allow in time the identifications local needs in terms of investment project for air quality management. This project is only focused to the Colombo metropolitan area. CA officials got opportunity to learn emission inventory preparation. Sri Lanka Malé Declaration Project. Sri Lanka has been an active participant in Malé Declaration on control and prevention of air pollution and its slightly transboundary effects for the South Asia project from the beginning, contributing to regional effort in air quality monitoring and data sharing. Through these initiatives, the country has strengthened its monitoring network and improved understanding of transboundary air pollution. We got opportunities for capacity building, knowledge sharing, and contributing to the research activities. After the Malé Declaration project became inactive, no any effective regional cooperation in terms of emission reduction strategies, policy enforcement, and real-time data exchange. Therefore, coordinated regional actions to control transboundary pollution remain insufficient. This highlights the need to strengthen regional collaboration, enhance policy integrations, and move from data sharing to joint action in order to effectively address this growing challenge. The Central Environmental Authority believes that the initiatives taken by Dr. Vanisha from AAT are RECAP and SAKIP will be successful, and that strong regional cooperation, including active participation by Sri Lanka, will be established in the near future. Future expectation from the Malé Declaration, strengthening of regional ambient air quality monitoring network and forecasting facility to assess the local and transbound effects by supporting countries who have not sufficient network by assessing existing facility, revisiting the regulation to identify the gaps, if any, introducing low-cost method and data validation procedure, sharing knowledge and information through regional cooperation, establish regional forecasting system. And second one, preparation of emission inventory to assess the level of air pollution in each country. Third one, improvement of indoor air quality by expanded systematic monitoring and high-resolution exposure assessment across diverse indoor environments. Epidemiological studies linking pollutant exposure to health outcomes in vulnerable populations. Capacity building and public awareness campaigns targeting mitigation strategies such as cleaner cooking technologies, improved ventilations, and behavioral interventions. Fourth one, capacity building, operation and maintenance of monitoring equipment, data management and validation procedure, monitoring and measurements, modeling and predictions, pollution control and regulation preparations. Thank you very much for everyone who participates here and who gave opportunity to present our management progress and our expectation from Malé. Thank you very much.
Okay, thank you very much, Vernika. It has already comprehensive work on air quality management in Sri Lanka, and I believe that we can have more of the programs together. And it's very interesting to see how much that Sri Lanka has developed despite limited resources that you have got in country. But hopefully we can get more the support. I will be very happy if we can have the conclusion from the AFD support project as well. I think it has the, if I hear correctly from what you're saying, it's about that investment that can be done, right, regarding equity management. So that will be something to help us shaping up in this Malé Declaration and see how it goes with at least for Sri Lanka. Okay, I'm not sure about Q&A. I noticed just a bit of, well, I think most people are just doing the chat. They okay. One our colleague say Midas Amudas Mohan, she mentioned about would appreciate if all the presentations are shared. Okay, that we will do, and she like to hear about how please throw more light on training young professionals and training to women. Actually, I'm interested in this part as well because as I have invited our female professionals in equity management, I don't know if maybe after I finish with all, I will ask each, or if Vernika have some hints for your own, for the ladies out there. About any particular training out there in Sri Lanka, you can say just briefly, please.
Actually, Anisha, we also searching some opportunity to not only women but also gentlemen who contribute hardly to this air quality management in the country. Actually, though I present here all the works done by not only the women but also gentlemen, also our staff members. I think it's time to establish any mechanisms to conduct training program as JICA or COICA conducted earlier. They conducted it very comprehensive manner, and I think actually regional cooperation need to strengthen that type of capacity building also, because it's very big gap regarding the air quality management in the region, I think.
Okay. Yes, yes. So there will be more, I think, of these opportunities as we identify that the training are still lack, yeah, in the region. Okay. I think we are still good on time, but we have last speaker. Okay, so thank you very much again for Vernica for your presentation. We will certainly ask for permission to share if you feel okay, or you can actually everyone can look at this webinar series afterwards, so you can actually take the part that you would like to, to refer to in your work. Oh, okay. Dr. Abhinaya also mentioned about the series of trainings by Health Effects Institute. This is a perfect moment. Let me further on introduce the next speaker. Okay, Dr. Abhinaya Sekar is actually our last speaker before we closed, and she's certainly important, last but certainly not least, but she's an air quality scientist, and she has 5 years of experience in air pollution policy and regulatory analysis in South Asia. So it's still very young, but I have a lot of experience, if I may think that it's a big country. She has been working, currently she serves as a consulting research fellow for HEI, the Health Effects Institute Global Initiatives, and is based in India. And so she joined in 2023 only, and she has been involved in the synthesis of scientific evidence, strengthening research capacity, and working together with local partners across South Asia. So, she got PhD already from University of Delhi, and I would like to, on behalf of everyone, welcome Dr. Abhinaya Sekar to tell us more about how important is the air pollution in India and South Asia as a whole, as much as the research has been indicated, and how we can address these solutions soon. Thank you.
Thank you, Vanessa, for the introduction, and thank you so much for having me here for the webinar series. Can I share the presentation? Can you see my presentation?
Not yet.
Okay.
Okay, now, yes. Good.
Okay. Yeah. Is it on the full screen? Can you see the presentation, the entire screen?
Yes. Oh,
can you see?
It's just gone. Please
Okay.
bring it back. It was full
Yeah.
screen.
Yeah.
Well.
Yeah.
Yes, thank you so much, Dr. Vanessa, for having me here, and also for the organizers that have and this for conducting such a webinar series, for bringing together women working on equality management across the region. We from the previous speakers, we listened more on the air quality management activities that is being carried out in different region. My talk will focus more on understanding the impacts of air pollution on health from South Asian population. So I work with an organization called as Health Effects Institute, and the institute work across the globe. And under our Global Initiatives program, we are more concentratedly working on low and middle income countries like regions like South Asia and East Africa. I take care of the work that we do across South Asia. So we do both research and capacity strengthening activities across this region. And the aim is to inform the decision that foster healthier environment and better health for all. So across the region, we build and sustain network of early career researchers. We train them by providing series of both in-person and virtual training programs. And our previous capacity strengthening program was in collaboration with ICIMOD at Kathmandu, Nepal, where early career researchers from India, Nepal, Pakistan, Bangladesh, and Sri Lanka attended the training series on air pollution and health. And we also conduct a series of virtual training series across different aspects of air pollution and health. And if you wanted to have any sort of training, please reach out to us. We are happy to work on you on that to bring everything together. And we also map and synthesize the available local evidence that we have in the region. So we have developed databases for South Asia. I can discuss more about this database as we go along the presentation. We also work with different organizations across the region to identify opportunities for clean air solution and for regional cooperation. So today, most of the findings that I would present here will be from our State of Global Air project. So State of Global Air analysis, it is a comprehensive analysis of levels and trends in air quality and health for every country in the world. And this is done in collaboration between the Health Effects Institute and Institute for Health Metrics and Evaluation. So we publish this report annually, and we also publish regional wise reports. So last year we published one for Central, South, and Southeast Asia. And getting into the numbers, so we are all, like most of us here are aware of this number. So in the year 2023, around 8 million deaths globally is due to air pollution. And who's affecting more is the adults who are over the age of 60. The impact is high of around 6.1 million deaths are occurring among the adults over the age of 60 years old. And why it is an issue in low and middle income countries. So of the global death occurring, around 90% of the air pollution death occur in the low and middle income countries. And when we look deep down into South Asia, it is the leading risk factor for death in the country. And even the traditional risk factors like high blood pressure, dietary risk, and tobacco are all behind the air pollution risk. So air pollution is the leading risk factor for death in South Asia. And as I mentioned earlier, even in this region, around 1.9 million deaths occur in the adults over 60 years old. As the previous speaker mentioned that household air pollution is still an issue in this region because of the use of solid fuels for cooking. And around 51% of the air pollution deaths in this region is due to the household air pollution. And air pollution is not just linked to respiratory illness, but around 1.1 plus million deaths is due to the cardiovascular disease linked to air pollution. And if you look at the country-wise number, the highest burden is seen in India. And it is also important to highlight that India is one of the populous country in this region. And who are at the highest risk? So this plot shows us the distribution of death happening at the different age group. And we can see that newborns in their first years of life and adults over the age of 60 faces highest burden. And if you can see, the burden is distributed for different pollutants, the ambient air pollutants, ozone, and the household air pollution. And we can clearly see for the newborns in the first year of life, the highest burden is seen due to the household air pollution, because they spend most of the time with their parents, with mothers who are involved in cooking, and we can see the highest burden due to household air pollution among the newborns in this region. And the burden is not just calculated in terms of death, but it is also calculated in terms of DALIs. So DALIs are calculated based on the years of life lost. For instance, in a country, if the life expectancy is around 70 years and a person died early due to air pollution, for example, in the 40 years, then third years of life lost is around 30 years. And if you have to calculate the years lived with disability due to chronic health conditions due to air pollution, for instance, chronic obstructive pulmonary diseases or asthma. So those years lived with disability is also considered to calculate the healthy DALIs, which is the measure of healthy years of life lost. And we can see here and the newborns in their first year of life, like we can see that, there are nearly 17 million healthy years of life lost due to air pollution exposure, because it is almost the entire lifetime is getting lost due to the death happening in the first, in the first month of their birth. So the impact is very higher among the children. And in terms of the particulate matter levels, all countries in South Asia experience PM 2.5 levels higher than the WHO's least stringent interim target of about 35 microgram per meter cube. For instance, in Bangladesh, around 100% of the population live in the region, live in the locations where the levels are higher than the WHO interim target 35 microgram per meter cube. And the issue does not the issue is not only with the particulate matter. We could also see consistently increasing level of ozone pollution in this region. So as we all know, ozone is a secondary pollutant which is not released directly into the atmosphere, but it is formed due to the reaction between volatile organic compound and oxides of nitrogen. Increase in emission of these pollutant leads to increase of ozone level in this region. And ozone is also a climate pollutant. And there are recently there are a lot of studies which is coming out from India showing increased level of ozone during summers. And it not just affect the human health, but it also affects the food security in this region. And in terms of burden, when we look at the burden, the death rate in South Asia is 11 times higher when compared to the higher income region. So the burden is higher in this region. And one good news is that the burden due to household air pollution, the number of deaths due to household air pollution is decreasing in the region, largely due to the government initiatives and awareness programs conducted on the access to cleaner cooking fuel and awareness on household air pollution. However, we could see still the death rates due to ambient PM 2.5 is increasing in this region. And as I mentioned, ozone, the burden of ozone is also increasing. If we look at the plot for the global, the impact at the global, largely the burden from ozone pollution is relatively stagnant between 2000 to 2023. However, if we look at in case of South Asia, the burden is increasing, and almost 50% of the global burden due to ozone comes from India. And ozone is also important to know that ozone is a respiratory pollutant. I would like to focus more on the impacts of children in this region, because they are the future generation, and they almost lost their entire life. They lose a lot of their healthy years. So it is the second leading risk factor for death in children under 5, followed only by malnutrition. And under the age of 5, 20 million healthy years of life is lost for children under 5 in this region. And when we look at the number of death happening for children under 5 in this region is more than 2 lakhs of death in the year 2023. And globally, if we look at of the total global deaths among children under 5, 32% of the death is happening in South Asian region. And how does this the impact is changing in children over time? So globally, air pollution has moved from third risk factor to second risk factor. And in the South Asian context, since last 2 decades, air pollution is the second leading risk factor for death. And among the first month after birth, 27% of the death is linked to air pollution. And in terms of death due to lower respiratory tract infection, 1 in 3 deaths due to lower respiratory tract infection is caused due to air pollution in South Asia. And in terms of number, it is more than 40,000 deaths in India, 12,000 in Pakistan, 800 in Nepal, and 5,000 in Bangladesh. So how does it affect your health? So we understood what is the burden and what are the levels of pollution in these regions, but how does it impact your health? So there are like 2 types of exposure. When you enter suddenly, if you from a cleanup place, if you're traveling to a city like Delhi or Dhaka, you can suddenly feel that your eyes will become red, your noses will start irritating. So these are all the impacts of short-term exposure to air pollution. Suddenly you will develop coughing. So something that air pollution is affecting you on within a few hours to days of exposure. And there are like after prolonged exposure for over months and years, we develop chronic health conditions like heart disease, high blood pressure, heart attack, lung diseases like lung cancer, chronic obstructive pulmonary diseases, and asthma. And there are also evidence that shows that long-term exposure to air pollution is associated with premature birth or babies being born with low birth weight, increased stroke, and recent evidences also shows that it is leading to dementia, incidence of diabetes, and others. So what does the global evidence say is that, air pollution almost impact all organs of your body. And recent evidence have reported that association between PM 2.5 and mortality happens with no evidence of threshold, which means even at the lower levels of pollution, even at 5, 10 microgram, even at the lower levels of pollution, there are evidences that shows it is associated with mortality, that is the occurrence of death. Uh, and uh, the, and even in the South Asian region, we have a lot of wealth of evidences that shows how it is impacting the population, which are conducted by the regional researchers, the local researchers present in the country. So the evidences shows that the short-term exposure to air pollution, for instance, the winter pollution episodes or sudden exposure to crop residue burning or forest fires, the evidence shows that the short-term exposure to air pollution increases emergency room visits due to hospital admission for respiratory and cardiovascular diseases. So these studies are conducted in regions in locations like Delhi, Kathmandu, and Dhaka, and there are also studies that shows that the short-term exposure to air pollution is associated with increase in blood pressure, and short-term exposure to PM 2.5 is associated with increased mortality. Mortality in the sense increased death. And recent evidence conducted in 10 cities in India have shown that there is a synergistic effect between air pollution and heat wave. That is, there is increased number of death during the high pollution period and higher temperature timing. And we have a wealthy of evidence on understanding the impacts of household air pollution. And this evidences date back to 1970s, how using unclean fuel for cooking is impacting the different health outcomes. For instance, use of unclean fuel for cooking has found as a risk factor for acute lower respiratory tract infection in children, and children who are exposed to solid fuels for cooking has a higher odds of developing pneumonia, and pregnant women, those who are exposed to solid fuel for cooking, deliver babies with lower birth weight when compared to those using with cleaner fuel. And there are also higher odds of delivering, going for a preterm birth or stillbirths. And there are like there are like a lot of evidence in this region on this, and there are also evidences that shows using solid fuel for cooking is associated with increased respiratory and cardiovascular diseases in the region. And among children, there are like variety or like the range of health effects is right from being born with low birth weight to developing children living in highly polluted region having less showing a poor lung function to those showing children with poor neurogenetic, like children who are in the higher pollution region have poor neuro have developed neurogenetic disorders like ADHD. So we have like local evidences on several health impacts for children in this region. So the key messages that I wanted to focus from the presentation is that air pollution impacts almost most of our organs, and it is a leading risk factor for death in South Asia in 2023. And in that half of the burden comes from the household air pollution. And the data that I presented now are the best available estimates on impact on air pollution on human health. But we need to strengthen the local data across the local data, health data on mortality and morbidity across South Asia. And we need to expand the air quality monitoring, as the previous speakers were rightly mentioning. We need to expand the access to air quality monitoring, especially for the pollutants such as ozone. And the impact is very much higher in low and middle income countries among children and older adults. So there are opportunities for clean air interventions to improve public health and well-being in this region. And or the studies that I've discussed during my presentation is all combined in a database. So this database is called as Database for South Asia Air Pollution and Health. We call it as DOSA. And this have all the air pollution and health, like mostly all the air pollution and health related studies conducted in six different countries, seven different countries: Afghanistan, Pakistan, Nepal, India, Bangladesh, and Sri Lanka. So we have combined it on a space in a place, and you can scan this QR code to access the web page, and I can also share the link on the chat box after the presentation. So you can, there are like 300 plus epidemiological studies, 100 plus health impact assessment studies. And the one good thing about this database is you can filter based on the region, based on the health outcome. For instance, if you want to look those studies that have looked at only the maternal health in this region, you can go filter it accordingly. If you have to look at only those that have looked at particulate matter or black carbon, you can go look at based on the pollutant. And there are also options to filter based on the country and type of the studies that have been conducted. And we are also developing summaries, country-specific summaries or health outcome-specific summaries from the database. If you want to work together on that, please reach out to us. And if you think that your studies are being missed out in this database, please write to us, because knowledge database is something that every country is working towards on. So please write to us. We'll be more than happy to work with you on this. Thank you so much. Here comes the end of my presentation. Thanks a lot for having me here.
Okay, thank you so much, Dr. Abhinaya. That is very informative and also leading to next, integrative of information. Yes, we really need the information so that we can really do the assessment, right, on this impact of air pollution to each and individuals. This is wonderful. If there is okay, I just want to read it out. There are a few question. Well, sort of a Dr. Paratipo asked again about thank you for the insight. And does your organization support or organize community-based training programs to reduce human exposure, particularly for rural populations in the region? If so, are there any documents available?
So for now, thank you for the question. So we do trainings for the government of officials on conducting the health impact assessment for on their own. We do trainings for the early career researchers, but we haven't done training for the community. For the community on reducing exposure, but this is something we would be happy to explore with our local partners who are working in this region on building community level awareness. So, yeah.
Right. Okay. And also the other question from Ms. Amodas, mentioned about the effects are lesser in the age group from 5 to 19 years, and this may include students in larger percentage. Any explanation, please?
Yeah, thank you so much for the question. And so in case of children, the newborn and those infants, the immunity or their organs are still developing. So the impact is very higher in that. So when you compare with the impact on the newborn, it's still higher for those 5 to 19 category. There like a lot of evidence that shows the impact is also higher on the adolescents. But when we compare in terms of the newborn and those under the age bracket whose organs are relatively developed, it seems to be lesser. And in that group, the newborn and the infant, whose the organs and the capacity to the immunity is still developing, the impact is higher for that age group. Yeah, and in case of older adults, since the organs have stopped developing, the impact, and they have additional comorbidities, the impact seems to be higher. But again, in this bracket also, like currently we are working with UNICEF on this project to understand the impact of children under 5 and also adolescents. What does the data shows in the South Asian region? So it shows that there are like a lot of evidence even among the adolescents group that the impact is higher, but comparatively lesser when this compared to the vulnerable groups.
Right. Very good. I think that's a very important point, and this like the next generations that we look forward for them to have a very healthy, life. Okay. And thank you so much, Dr. Abhinaya Sekar. With the limited of time, I believe there are many questions in the mind of the audience, and also there are actually I missed 2 questions from for Sri Lanka as well, asking about a community-based training program for rural women in Sri Lanka, and also about the need for air quality monitoring for EIA and industries. These are probably for our air quality management officials from Sri Lanka, Ms. Vernika, and maybe if Marius can say something also about EIA, if you may have that. Can I ask Vernika and probably Maiha, if you have any answer to the second question about EIA, the environmental impact assessment at industries, and also the need for environmental sustainable goal, I think, reporting, ESG reporting for industries. Maybe the last minute, if anyone can reply. Is Vernika and Maiha there? Or maybe they're very busy. Can you turn on your mic? Maybe they're taken.
Dr.
Yes.
Vanisha, could you please explain the question again? It's not clear to me, and I unable to see on my Q&A portion.
Oh, okay. The question was about if you have any community-based training program for rural women in Sri Lanka. I guess, yeah.
We don't have, that is very big gap here. We want to disseminate our informations to rural recipient, but we didn't get any chance to conduct that type of communication program. But we are conducting awareness program to children, school children, and the school teachers and government officials up to now, but I think Minister of Health and collaboration with Minister of Environment will can do something more than that we are doing. Actually, if any organization can help us to conduct this type of program, because we are working with very limited workforce, and we have very big problem to reach every end, that if any NGO or any non-governmental organization can contribute to this type of initiatives, it will be more effective, I think.
Okay, yeah, certainly. I think some other countries also have such experience that the training has to be conducted separately from the implementing agency, like our NCAA in Sri Lanka. Certainly, we have another part of the question from another person about EIA, Environmental Impact Assessment. It seems to be conducting, by regulation, right? But still, has it any link with SDG, the Sustainable Development Goal? If anyone can say about that.
Actually,
for
to achieve
industries.
SDG goals, we are doing so many actions to prevent air pollutions and climate change perspective, to reduce some air pollution levels. Indirect, not sometimes directly or indirectly, we are through the impact assessment procedure, we are contribute to achieve SDG goals. That means we guide them to control air pollution and direct them to go to renewable energy sources and sustainable manner to overcome success their projects. I think it's integrated with SDGs and directly integrated with SDG goals.
Okay, thank you. And also, sorry, thank you for correcting that ESG is more environmental social governance reporting. Yeah, so it will also include the social and the governance reporting for the industries. Anyone want to say the last word for that?
Oh, and I can add
please,
something regarding the need for air quality monitoring in EIAs. I mean, for instance, in the Maldives, even if we don't have national air quality standards, the EIAs would still monitor. I mean, it would still check the baseline air quality at the site, so that it can establish a baseline condition. This will help in the monitoring plans when the project is underway, and so we'll know how much impact this project or this construction project is actually, how much it is affecting the baseline conditions if we actually check air quality levels before the project is implemented. So I think, yeah, there's a need for air quality monitoring in EIAs. That's it.
Yes, certainly. Thank you so much. Okay, due to the limited of time, maybe we improve the program in the future to allow more time for the Q&A as well. But we have last 5 minutes to end the webinar today. And I highly appreciate all the speakers. And today I'm joined by the Executive Director of Clean Air Asia, Ms. Glinda Bazan Batarina, who has a part of my inspiration to really conduct this today, Women Driving Changes in Air Quality Management for Better Air Quality, after the Better Air Quality Conference conducted in Bangkok earlier this month. So we are so fortunate that she can join us today to give a sort of congratulatory remarks before we really close the event. Glinda, please. She's a lawyer by profession, as I recall, and a long-term, like driving force for air quality for the whole Asia. So I can't say too much now. I think let Glinda
You.
please say your part. Thank you so much.
Thank you so much, Dr. Vanessa. A very good day to all of you. It is really my and my organization, Clean Air Asia's honor and pleasure to extend the warmest congratulations on this landmark first regional webinar of the Malé Declaration series. Very appropriate title, Women Driving Changes in Air Quality Management for Better Air Quality in the Malé Declaration region. This first webinar, I believe, is held in celebration of International Women's Month, and I'm happy to hear that it is inspired by the recently concluded Better Air Quality Conference 2026 held in Bangkok, which is a flagship conference of Clean Air Asia. And that's why it carries a special resonance, this webinar. And guided by the forward-looking vision of SACEP Director General Mr. Norbu Wangchuk, we shine the spotlight on the extraordinary women who are not just participating in air quality management, but they are leading it, reshaping it, and driving it forward. So I wish to extend my deepest thanks and appreciation to the key partners and leaders whose dedication has made this webinar possible. And of course, my sincere gratitude goes to Dr. Vanessa from the RRCAP, as well as to the director, Dr. Gilberto Barongan, for their steadfast support, their technical guidance, and their commitment to strengthening regional capacity in air quality management. I also offer my heartfelt thanks to our distinguished speakers, Mr. Vernica from the Central Environmental Authority of Sri Lanka, Ms. Aminath from the Ministry of Tourism and Environment of the Maldives, and Dr. Abhinaya from HEI India. Thank you for so generously sharing your expertise, your experiences, and your inspiring journeys with us today. And to every woman, government official, researcher, scientist, project leader, policymaker, technical expert who is present and watching today, congratulations. Your work on transboundary pollution, on source apportionment, on health impact studies, clean energy solutions, clean energy transitions, and community level awareness, they're already delivering measurable improvements in the lives of millions across South Asia. If we really pause for a moment, we recognize the deeper significance of this contribution. You know, air pollution does not discriminate, yet its burden often falls heaviest on children and women, whether through indoor cooking smoke in rural homes or respiratory illnesses in growing urban centers. By stepping into your roles in air quality management, you're not only solving a technical problem, but you're also proving that women play a very important role so our entire communities can breathe easier. Your stories of persistence, innovation, and quiet determination will echo far beyond this webinar. They will inspire the next generation of young men and women to see that science and policy are inclusive spaces where talent determines success. Again, I'd like to congratulate the entire organizing team at SACEP and AITRRCAP. By choosing this theme for your inaugural webinar, you have sent a clear and powerful message that the future of the Malé Declaration will be shaped by inclusive leadership. Without further ado, once again, heartfelt congratulations to all women leaders who have spoken sharing their work and driving change. Congratulations to every one of you who has chosen to be part of this movement for clean air. So thank you, everybody, and thank you, Dr. Vanessa.
Thank you so much, Glinda. She's have completed remarks given to us, and as a good start for us as well to really continue the webinar with all these. Not only the technical part, certainly, but also, whatever that each of us can do in order to make a better change. Thank you so much from the Manila out there at Clean Asia. We hope to have more collaboration in the future works as well. Thank you very much. And I think that's come to the conclusion and the end of today's webinar. We hope to see you again at the end of next month, Monday, last Monday of the month. Hopefully, we will send more of the news as we confirm the program of all the speakers at the end of the month, each of the months this year. And please look forward to hear from us. And if you have more questions, you are welcome to send in more questions as well. And we will try to, design to address all the needs of making the change in air quality management for the whole Asia and starting from here, South Asia, with the Malé Declaration. Okay, thanks very much, and I see you again. Have a good evening or afternoon wherever you are, and yeah, till then, next time. Okay, bye bye.